A sports injury is a common problem for all types of athletes, and it can be a setback. But with the proper treatment and rehab, you'll probably be back to action soon. We spoke with Dr. Russell Petrie at Hoag Memorial Hospital Presbyterian in Newport Beach, who gave us more information on sports injury treatments and told us how sports medicine has changed over the years.
One of the things that has changed in the treatment of sports medicine is what we consider sports medicine and whom we apply our treatments to. Many years ago, we just basically kept it to the very young population. What we realize now is that people are athletes throughout their whole life, and we can't just simply limit our treatments to people based on a year they were born. Additionally, with sports medicine and treatment of these types of injuries, our knowledge of anatomy, function, biomechanics has really increased over the last 20 to 30 years. We now talk about doing double bundle posterior cruciate ligament reconstructions, double bundle ACL reconstructions, and these things that were barely conceived of 20 or 30 years ago. Additionally, graft types, particularly as they relate to ACL reconstruction, have really changed over the years, whereas the gold standard had always been bone, tendon, bone ACL reconstructions. There's a lot of people in the world that think that hamstrings are perhaps better. The other thing is that really has changed over the course of the last 10 to 20 years is the technology. Our ability to do things has increased as our equipment has improved. Arthroscopic equipment in the 1980s barely resembles what we have today. We have high definition cameras, and more importantly, we've developed things to work in confined spaces. And so while we would do open rotator cuff repairs in 1988, 89, the development of a lot of the arthroscopic equipment, smaller instrument suture passers, has really allowed us to do things in a truly minimally invasive manner. By doing things with 3 or 4 small incisions no longer than ½ an inch versus doing things with an incision 6 or 7 centimeters long. One of the things that we've learned over the last several years is being able to predict which people are better for arthroscopic techniques and which people really do require an open technique, because despite the fact that we think that the arthroscopic procedures are better, there are still situations in which open technique is a superior operation, but we're now just being more facile in being able to predict which one's better for which patient.
Dr. Petrie told us how effective the treatments for sports injuries can be.
I think the reality of the situation is that most of what we do is probably 85 to 90% effective in terms of getting rid of discomfort and improving whatever limb we're operating on. People have now looked at treating sports fractures in different ways with more minimally invasive techniques to allow people to return to sport even after fractures. So a lot has changed over the last 10 to 20 years. Not the least of which is the understanding of our anatomy, our attitudes to our patients, who we think are sports people, and finally the technology has improved.